Welcome to this Warford Orthodontic Straight Talk podcast. This is episode number 1. In this episode, we're going to discuss the difference between a dentist and an orthodontist and why it's important when making your decision to get braces. Once again, welcome to this Warford Orthodontic Straight Talk podcast. This is episode number 1. I'm your host, Scott Wild, along with Dr. John Warford. Welcome.
Thank you.
Now, we are podcasting from the Warford Orthodontics office here in Bismarck. And I want to just start off by just explaining a little bit about who this podcast is for. I mean, really, it's for those people that might be already clients or might have braces or Invisalign or whatever it is, and in the process of treating their teeth. Or it might be for those people who are on the fence. Maybe it's themselves or their kids, and they've been kind of back and forth on, should we do this? Is this the right thing? So,
is it the right time? When is the right time?
When is the right time? So we're going to, each episode, we're going to kind of unveil some of those pieces of information that will help people make educated decisions.
Yeah, there's a lot of misconceptions out there about orthodontic treatment. And we spend a lot of time each day explaining that many times over and over and over again. So I think it'll be very helpful.
Well, let's start with this episode just by discussing just that. I mean, what is the difference between a dentist and an orthodontist? Because dentists will put braces on, correct?
Yep.
So what's the difference between the two?
All orthodontists are dentists, and not all dentists are orthodontists.
Okay.
And so in my case, I'm a dentist and I'm an orthodontist. I graduated from dental school first, and that's a requirement to be an orthodontist. You can't be an orthodontist not having gone to dental school. So after the first 4 years of college, or 3 years in some cases, you go to dental school. That's almost always a 4-year program at a university. Mm-hmm. And to become a dentist, you're at a university accredited by the American Dental Association. And then to become an orthodontist, that's an additional 2 to 3 years of education, again, at a university accredited by the American Dental Association. So it's a longer education. It's kind of a full-time education of 2 to 3 years of very intensive study, learning everything there is to know about orthodontics. Many times people think that orthodontics seems very simple, but it really isn't. It's a lot more complicated than one thinks.
And so for those people who really don't know what orthodontics is, in a nutshell, can you put it in layman's terms, but what is orthodontics?
Orthodontics is straightening teeth. It's moving jaws, moving teeth to get certain desired results, knowing how to do it the most efficient way, the best way. It's not easy, especially to move, to kind of predict growth in jaws and to help kids grow in a certain way. And there's different challenges at different age groups. We put braces on everyone from 7 or 8 years old all the way to, I think my current oldest patient in treatment is 78 years old.
78 years old?
Yeah. And his teeth move like he's 35 years old. So there's a misconception that people think that I'm too old for braces. I heard that just yesterday, actually. But it's really not the case.
So you don't fill teeth. If I have a filling, you drill my teeth.
Exactly. So I know how to do all those things, but yeah, we strictly are limited. We limit our practice to moving teeth and moving jaws, and I haven't done a filling or a crown in 12, 13 years now. I haven't given a shot in 13 years.
In essence, you work as a partner with dentists.
Exactly.
They take care of the other needs, and then you are the ones that move. In fact, what I think is ironic is that you have a lot of dentists who send their kids to you for braces.
Yeah, we've got braces currently on quite a few kids of dentists, and we work kind of as a team with the dentists, and we work as a team with other dental specialists, oral surgeons, periodontists, endodontists, and things like that to help kind of coordinate the team effort. Because some people, and especially adults, sometimes have sort of a team approach as opposed to one-stop shopping.
And so, what would be one of the disadvantages of, say, not going to an orthodontist versus a dentist? I mean, a lot of dentists say, hey, I'll put those braces on you, but what are some of the things that could go wrong?
Well, this isn't my first rodeo, and I learned a long time ago that what experience can teaches you is how to not get ourselves into trouble with a certain situation, and know how the sometimes very simple things, they're not really all that simple. Right. And sometimes many dentists or some dentists will put braces on people, and I'm not to pass judgment on that because they certainly can do that. The hope is, though, that they recognize the limitations and they refer out when it's appropriate, when the situation is a little bit more than they think they can handle.
So if I'm a parent and I have kids, at what age should I start bringing them in to an orthodontist to get them checked?
Well, the American Association of Orthodontics has for a very long time recommended by age 7.
Okay.
And we actually have the web address byage7.com. The reason why is that many times we won't see a child until they're 12, 13, 14 years old, and we've lost a window of opportunity before the permanent teeth had come in to make some changes to help things go better in the teenage years. So although only about 25% of the kids 7 to 9 that we see actually need something, we only treat severe things and severe problems at young ages where we might look back at 12 or 13 and wish we would have done something to make it go better.
And you have had those cases where they regret not doing something earlier.
Absolutely, yeah.
And that can cost more time, more money, right? I mean, and more problems, pain.
Seen it multiple times a day already.
Yeah, so it's kind of preventative at the age of 7.
Absolutely.
You're looking to create a strategy, I guess, for the future.
Yeah, and for a personal note, even my oldest daughter had braces on at 8 years old.
So let's say that someone is on the fence and they have considered it. I mean, myself, I'm 47 years old, and I thought I was way past the age of getting braces, and all of a sudden I started to see more and more adults getting braces and straightening their teeth, but I never really still considered it for myself. And I guess working with you has changed my mind, and now I'm about to go through the Invisalign process. Mm-hmm. And I think what it was is before I didn't think that I needed, I'm 47 years old. Why would I need to straighten my teeth now? People know what I look like.
Yeah.
But when I started to understand the health benefits behind it, that's what really changed my mind.
Yeah, and traditionally about 25% of our patients have been adults. And adults are they're some of the most gratifying patients to work with because they really know what it was like to live with the crooked teeth. And then they get the straight teeth and they're really, really, really happy. Many young kids don't really know, they don't quite understand the gift that is orthodontic treatment. And so 25% in the past for adults, I think that's gone up, especially with the advent of, not the advent, but when Invisalign has become more in use, because many adults are very willing to have Invisalign as their orthodontic treatment. And they say to me time and again, I don't think I would have been able to quite go for the braces.
And for someone who doesn't know what Invisalign is, can you just give us a brief description?
Invisalign is a way of straightening teeth without braces. It's a series of clear plastic aligners that you put on your teeth, changing them out from time to time to make the movement occur. It happens very much in the same way that braces does, but it's a little more of a staged process, and it works very, very well.
Okay, so let's say that I'm on the fence. I've considered getting braces, or I've looked at my kids and thought, maybe I should have them checked out. What is the process for getting an appointment? I mean, what are the initial costs for that first appointment, things like that?
Well, if I can make a comment first on the being on the fence thing. It's better to know what's going on with a child, for example. Many times the teeth might look great, but there might be something going on in the bone with a tooth that is not yet erupted. And knowing that ahead of time can really help people plan things out. It's pretty rare, if ever, that there's an orthodontic emergency where you need to have braces on yesterday. Yeah. And so many times, especially with the younger kids, we can tell the mother of the 8-year-old, looks like your child is going to only need braces one time. We're going to see you back periodically to monitor the growth and development. And we kind of give them an idea of the age range. As we get closer and closer and closer, it helps them to sort of plan for the investment. And so as far as how things go for getting an appointment, you do not need a dentist referral. That's a big misconception, is that you do not need a dentist referral to see an orthodontist. Anyone can self-refer. And our initial examination appointment, including appropriate x-rays and photographs, is at no charge. And we do that all the first day, and only in very complicated cases where there's other doctors involved do we not tell you kind of exactly what you need to know that first day. And I'll do it in one appointment. So
when I started with my Invisalign, the scan that you did of my mouth to get the image of my teeth on the computer and the video, that's included in that initial visit?
Yep, exactly. It can be if someone is an Invisalign candidate and they would like to have that done, yes.
So you could literally show someone what their teeth are going to look like on that first free visit.
Absolutely.
And before they even make the decision to do it. That's incredible.
Yeah, and that's the new technology that's we're the first in North Dakota to use that for orthodontic purposes. conferences, and we've only had it for 2 months now. It's a lot of fun to show people ahead of time, and all Invisalign, we've been able to do that, but just not that first day. We've been able to simulate for people, but it's pretty exciting to be able to email you ahead of time. Hey, here's what your treatment's going to look like. Can't wait to get started, sort of thing.
Well, I'm really looking forward to doing this podcast with you. We're going to wrap up episode 1 here. If you want to make a request for an appointment, you just go to warfordorthodontics.com/request, or you call 701-255-1311 and just talk to Diane at the front desk, and she will hook you up.
Absolutely.
Thanks a lot.
Thank you.